I'm Dr. Donald Ross Osborne. I've just recently returned from hospital having had major surgery, a total knee replacement joint. The surgery was done by a gentleman called Mr. Raj, very nice chap. Explained the operation fully, and I was quite comfortable with everything that he told me and everything that I expected to be able to do following the operation. I did experience a little bit of pain, but no more than you would expect from having had major surgery. Following 2 weeks, which is up to the present time, there's been hardly any pain at all, only sufficient for me to take the occasional painkiller tablet. Apart from that, I can almost resume my activities. This is my most comfortable chair, and I find I have no difficulty at all in rising from the chair in a manner which I have adapted to suit myself. I just lean forward and pick myself up and stand up so. There's absolutely no problem at all. I'm just going to leave the cottage now, and I'm going to go into the main house, into the kitchen, and there are a couple of steps there for me to negotiate, which are no problem at all. Right, I'm going into the main part of the house now, into the kitchen, and this I find is the easiest way to do. I come down quite easily. I always lead with my bad foot first, which is the procedure that I am now able to use my sporting rifles and guns, and I can rotate quite easily from more or less any position, whereas previously, if I had done this, I would fall over. Well, I'd just like to demonstrate some of the other fancy movements I can make, like the hula hula dancing, you see. I mean, and I can also wriggle around.
Yeah, that's hip action, not knee action.
That's going on the knee joint is going round, look.
Mm.
See? I'm not very good at standing on one leg, but I'd like to introduce my wife now, who is also my carer and responsible for looking after me now that I'm recovering at home. I think she'd like to say a few words with regard to how I was prior to the operation and consecutively following the operation. So what do you think, darling?
Well, before the operation, certainly, he was in very, very great pain with the knee, which at first I thought was just arthritis, but it isn't, obviously, or it wasn't. Also, he would fall a lot. He wasn't able to take his weight on that leg. If he turned suddenly, he would fall over. So consequently, when this operation was suggested, I felt that it would be a big improvement as to his quality of life. I really did feel that, and I think he's improved a great deal in many, many ways.
And that's all down to, thank you, Mr. Raj, surgeon.
I just want to further add that my husband, who's now 83 years old, in fact he had his birthday 2 days before the operation. As it's less than 2 weeks since the operation, I think that Don has done remarkably well, and we're very, very pleased with the whole outcome.
And of course, personally myself, I'm extremely grateful to my surgeon, Mr. Raj, for explaining the detail before, during and after the operation, and for well, making me feel as comfortable as I am now. Thank you very much.